What medications are used for bladder pain relief? If you're dealing with bladder pain, especially from conditions like interstitial cystitis or bladder pain syndrome, knowing your treatment options can make a big difference. Let's explore the medications that are commonly used to help manage and relieving bladder pain, always keeping safety and scientific evidence in mind. The main oral medication approved by the Food and Drug Administration for bladder pain related to interstitial cystitis is pentosan polysulfate sodium, often sold under the brand name Elmirn. This medication works by repairing the protective lining of the bladder, called the glycosaminoglycan layer. When this layer is damaged, it can cause leakiness, inflammation, and pain. By restoring this barrier, pentosan helps reduce bladder discomfort over time. Usually, it takes about 3 to 6 months of consistent use before patients notice significant relief. Side effects are rare but can include hair loss, nausea, diarrhea, or rash, which are generally reversible once the medication is stopped. Another common approach involves low doses of tricyclic antidepressants, especially amitriptyline. These drugs help relax the bladder muscles, interfere with pain signals, and can improve sleep, which often gets disrupted in chronic bladder pain cases. They are often prescribed at doses lower than those used for depression, making them tolerable for many patients. Antihistamines like hydroxyzine are also used to manage bladder pain. They work by blocking histamine releases from mast cells, which are involved in inflammation. This can help decrease bladder inflammation, reduce pain, and lessen urinary frequency and nighttime urination. Hydroxyzine is usually taken at bedtime because it can cause drowsiness. Over-the-counter antihistamines like loratadine or diphenhydramine may also provide some relief, but always consult your healthcare provider before starting any new medication. Other oral medications that might be part of a treatment plan include cimetidine, a histamine blocker, and alpha blockers such as tamsulosin, which relax the muscles in the bladder, neck, and prostate area. Some patients benefit from anti-seizure medications like gabapentin or pregabalin, which can help calm nerve pain. Urinary antacids containing potassium or sodium citrate may also be recommended to reduce acidity and soothe bladder irritation. For mild to moderate pain, over-the-counter options like non-steroidal anti-inflammatory drugs, such as aspirin, ibuprofen, or naproxen, can be helpful. However, long-term use of these medications should be discussed with your healthcare provider to avoid potential side effects like gastrointestinal issues or kidney problems. In addition to oral medications, bladder installation treatments are used for more severe cases. Dimethyl sulfoxide, or DMSO, is the only FDA-approved medication for direct bladder installation. It is introduced into the bladder through a catheter and helps relax the bladder muscles, reduce inflammation, and ease pain. Typically, patients undergo weekly treatments for about 6 weeks, and many experience symptom improvement. DMSO can cause a temporary burning sensation during the procedure and may leave a garlic-like odor on the skin and breath for up to 3 days. Other bladder installations include sodium hyaluronate and heparin, which aim to restore the bladder lining and decrease irritation. Sometimes, combinations of medications are used to tailor treatment to individual needs. In more severe or resistant cases, immunosuppressive drugs like cyclosporine or mycophenolate may be considered. These medications suppress the immune response that contributes to bladder inflammation, but they are used cautiously due to potential side effects and are typically reserved for cases that do not respond to other treatments. It's important to remember that managing bladder pain often involves a combination of therapies. Finding the right medication or mix of treatments can take time and may require some trial and error. Always work closely with your healthcare provider to monitor how you respond, manage side effects, and adjust your plan as needed. While there is no cure for conditions like interstitial cystitis, these medications can help control symptoms, protect bladder tissue, and improve your quality of life. If you're considering any treatment, Consult your healthcare professional to develop a personalized plan that's safe and effective for you.